Hello, I'm Stephen Thomas and I'm a podiatrist, which is a foot and ankle specialist. I'm based in Harley Street in London, and in this video I'm going to discuss the notorious heel pain condition called plantar fasciitis. Now this affects about 7% of the population. It represents about 15% of all foot and ankle complaints and can affect up to about 10% of runners. So there's a good chance that you or one of your friends or your family members have suffered from this or may suffer from this in the future. In this video, I'm going to discuss what the plantar fascia is, the typical presentation, how it generally develops, and how you diagnose it. So typical presentation is usually a sharp pain at the bottom of the heel, and it's usually first thing when standing in the morning or after long periods of rest. The pain usually starts to improve once you start walking a little bit, but it can also start to develop into more of like a warm, burning, throbbing pain if you've been standing for long periods of time or after long walks. So the plantar fascia is a ligament type structure underneath the foot, and looking at the foot model here, it connects into the heel bone just around here, and then it travels up under the foot and fans out underneath each one of these joints underneath the foot. It acts as almost like a stabilization for the arch. So it travels from the heel, goes across underneath the joints here. It sort of brings the arch back together again. So it acts as a little bit of a spring and tension on there. So if we simplify this and say that the bottom of the foot is like a triangle, then the bottom of the triangle, which is the fascia inserting at the heel, running up to here, and then you get the top of the triangle, which is the arch profile of the foot. As the arch comes down, you see the distance between the heel and the forefoot increases in length. And that's sort of like a simplification of the mechanical principles that aggravate this condition. Pain usually affects where it inserts into the heel at this point here, usually on the inside of the heel. So plantar fasciitis is usually classed as an overuse injury. So it's usually people that have repetitively aggravated the fascia, and this can be down to a number of different things. So sometimes it could be, during the January New Year's resolution period where people start to, they're super motivated to get into shape, and they suddenly increase their activities, go to the gym, start running several times a week, and they can develop this pain. If you're overweight, the increased weight of your body pushing down through the foot can have an effect. In some cases as well, if you have a flatter foot, you might be of increased risk of developing this. Some footwear may be extremely flexible, and in the wrong combination with the patient can increase motion in the area. So there's a number of factors, but generally it's classed as an overuse injury. So increasing your activity levels can develop this sort of pain in the heel. The plantar fasciitis is usually diagnosed clinically, and you correlate the history of the patient, the typical symptoms that they have, and then clinical examination of the foot. So there's usually pain on palpation of that bottom of the heel area. If you stretch the toes backwards, that actually stretches the plantar fascia, and that increases tension on the fascia. So when you do that and you press the area, if it's more painful, then sometimes that means that it's the plantar fascia that's causing the pain. There's a number of other things you want to rule out at the same time. So you want to rule out things like a heel fracture. There may be some heel bruising. You could get Achilles tendinopathy. It's not quite exactly in the right place, but it's close by. And some other things like you can have a inflammation of the fat pad and surrounding structures around that area, and sometimes fairly close by you can get some tendinopathies underneath the foot. So careful examination, but also correlating it with the clinical presentation and history. Imaging can be used to help diagnose this. So on an ultrasound scan, you would put the probe on the heel. The plantar fascia thicker than about 4 millimeters is usually indicative that this is plantar fasciitis that you're dealing with. Other imaging, such as like MRI, may show up some tears and inflammation in the area, may show up some bone edema as well. So imaging can be helpful in some cases. especially if symptoms are not settling down or you suspect that there's maybe a more severe case of plantar fasciitis at play. I hope you found that video useful. Please like and subscribe to the channel, pop any comments you have in below, and if you're interested in finding out about the treatment options, then look out for the next video coming up shortly. Thank you very much.